I just got the text message. So we are up. Thank you for waking up early. And I know you have very long days and long evenings and everything in between. So we really appreciate you being here for us.
Absolutely.
For those people who are just waking up and joining us, good morning. My name is Sonia Azad. I'm the health and wellness reporter at WFAA, and I am joined by Dr. Mark Casanova. And Dr. Casanova, you're the president of the Dallas County Medical Society?
That's correct. That's correct. I'm also a member of the Texas Medical Association COVID-19 Task Force.
Yeah, that's good to note these days as well, certainly. And you were involved. I mean, you have studied infectious disease, and you've been involved in the response to infectious disease in the past as well. We should note that.
Yes.
So, you guys at home and wherever you might be joining from, we've done these Q&As before, and I just felt like it was kind of time to do them again because, of the numbers we're seeing, yes, in terms of COVID-19 cases rising all around us, but particularly for me and Dr. Casanova, I don't think I've even talked to you about it. I feel like the circle is closing in, meaning I know a lot of people who have it right now. Now, I've known people who've had it since the start of this whole thing, but for me to get 5 text messages or phone calls in 1 or 2 days with friends going, uh-oh, I think I have it. These are my symptoms. What do I do? Where do I go? I just felt like this would be like a good reminder for people who may not have been paying attention before because it didn't affect us before, in the same ways. So first of all, can you just give us a little update about where we stand? Because I think people go, well, the case numbers are up, but that's because we're testing more or the testing capability is more. Can you clear that up for us?
Right. So I think you make a lot of good points, Sonia. And first of all, yes, that 6 degrees of separation that many of us experienced in the spring or summer is now down to maybe 2 degrees of separation. And if you still don't have a close contact who's had COVID, I would say regrettably give it a minute because you will eventually know somebody who does. Right now, we are in an exponential phase of an increase in numbers. And you're also right to point out that one of the contentions at times is that if we do more testing, we see more numbers, more positive cases. But that's why from early in the pandemic, we've looked at hospitalizations as being a true measure of the situation on the ground. And we are regrettably seeing those match. So not only are these a true increase in numbers, a true increase in percent positivity, in other words, the percentage of positive tests of the tests that we are doing, which would not be the case if this was just an increase in number of tests. As a matter of fact, your percent positivity would go down if that was really the situation, that you're simply just testing more. But unfortunately, our hospitals and our ICUs and our emergency rooms are seeing a very clear increase in severely ill COVID-19 patients once again.
Yeah, I feel like every doctor I've talked to, anyone who works in an ER, any nurse I've talked to, and again, these are people who are close to me, so they're telling me, with authenticity and also, with vulnerability, what they're seeing inside, and a lot of them are really, I don't know if shocked is the right word, but they're really concerned about what they're seeing inside. Like they're getting to the point where they're calling me and saying, Sonia, I haven't seen these numbers. We haven't been to this place that we are at since, the very beginning of this thing. And I do think, there was a sense at the beginning of fear that maybe people don't have now. And some people, I should say, right? Like some people are kind of walking around going, well, I'm going to take calculated risks, which we all have to, I understand that, but it's not going to affect me that much. I'll just kind of sit at home for 2 weeks and, maybe this person doesn't have kids to think of or doesn't have elderly people who he or she is around, but it's more than that. To me, it's like, how do we know what's going to happen to these systems of the body down the road? So am I off base in thinking that? I mean, I don't want to be constantly living in fear, but that to me is a real issue and a real concern. The fact that we don't know how this virus is evolving. I mean, we're living through its evolution.
No, I think you're right on target, and I would put fear in a different category than informed respect. And what we need with COVID-19 is informed respect. And I think when you have that, and we're increasingly understanding the scope of impact of COVID-19, not just imminent severe illness that can lead to death, yes, in higher risk individuals, but also in otherwise healthy individuals. But then there's a long-term sequelae that we're beginning to appreciate with this virus. So that informed respect and that understanding that, okay, maybe I personally don't have, an 80-year-old father who lives under my roof, but my friend at work does. And just trying to understand that all those dots easily connect with such a transmissible virus, and especially when we're in this exponential phase. I'd also point out that your contacts and your friends who are physicians and nurses working on the front line, I think they're at this point the fear aspect in the beginning applied not just to the public. The public was fearful. We were fearful too. We weren't sure what we were dealing with. We were seeing in March and in April news stories come from Italy and other areas of the world, and certainly the situation unfolded in New York. So it was brand new for us at that time. I suspect that some of the sentiment, the emotion underlying those friends and contacts you have is also a component of dismay. That here we go again, but we know it's going to be worse. And we know how bad it was in the summer. And frankly, we've been at this now unceasingly for 9 months, 8 months, give or take. I kind of lose track of time. But it's been a while, and we know the fight that's on our doorstep and that's already unfolding in our ICUs. And I think that dismay, and it's not a lack of commitment to do everything we can to save as many lives as possible. I think the dismay is we know the relatively simple ways to mitigate this. What can we say? What can we do to get back to that sense of self-responsibility, the fact that we're all tied in together with this, and more than just simply wearing a mask, but making those own personal, familial, and friend-based decisions that, we probably need to forego this gathering we were looking forward to this weekend for our friend's birthday party. There's a birthday next year. And if we don't do this right, one of us is going to be missing, or somebody's parent will be missing next year when that birthday rolls around again.
Man, you just gave me chills saying it like that, but that's what's happening to so many families. I just had a conversation with someone on Instagram who sent me a note that her brother died from COVID, and 6 of their family members have had it. Now, I think some people go, well, why? How does that spread within the family that much? You guys, you got to think about the fact that not everyone has the opportunity to work from home. Not everyone has the opportunity to leave their kids in a school, homeschooling situation. So there is movement. And so we just have to learn how to adapt in a smart way to all that movement. Dr. Casanova, can you go over the good news, right? Because we hear this good news from Pfizer. We hear about, this antibody treatment. Okay, although it's only available to certain people. But I want to shine a light on what we are talking about in the news so that people better understand it. So what does this news from Pfizer mean? And how quickly, let's talk about timelines, right? Like how quickly could we viably get this vaccine rolling?
Yeah. So I think you're on point. Silver lining. Okay, there is hope on the horizon, but let's put it in context. And it's not to take away hope and joy in these discoveries, but we want to understand that it's gonna take a little bit of time before we get there. So first of all, the Pfizer vaccine, very hopeful initial results, and it appears to be 90% effective. Of course, when you roll out a vaccine beyond 40,000 or 4,000 that range participants to the masses, you're really then going to see much better, more reliable data. So we anticipate that in the early part of 2021, thereabouts, we'll begin to see the early distribution of limited Pfizer vaccine. Now that's going to go to very high risk individuals, nursing home patients and the like, as well as high risk healthcare workers or workers who are in high risk situations.
So they'll get it first.
Right. That's going to be the first wave. Then there will be sort of a subsequent groups that are in line. Individuals with who are not living in a nursing home but do have those high risk medical conditions.
Mm-hmm.
The rest of critical infrastructure workers. We want to make sure that our police force, our firefighters, the folks who run the power plants and water plants are protected and can work and not fall ill. And then eventually you'll get to the general public. That time frame, that general public time frame, individuals of average health and average health risks is probably in the spring to summer range. So I think just realistically, we need to understand that this is hopeful, positive news, but we need everybody still practicing those strong safety mitigation measures.
It's funny. I said my birthday is in July, and I said to some of my friends, if I get a vaccine for my 40th birthday, that would be a miracle.
Yeah, who knew we would be so excited about shots? But we should be. We really should be. This vaccine has distinct potential. It's also important to remember and acknowledge the Pfizer vaccine may not be the only vaccine that comes into utilization. There's a possibility that we'll have at least one, maybe several others as research continues.
And then what is the deal with the Eli Lilly antibody treatment?
Right. So the Eli Lilly antibody treatment, again, silver lining there, new tool in our tool bag. Limited dosages. It is designed and intended for individuals who have serious illness, but not yet sick enough to be in the emergency room. It's an infusion, and it requires an hour infusion and then about an hour period of observing the patient to ensure that there are no adverse reactions. So the logistics of this is going to be a significant issue. Once again, we anticipate in the initial phases, as with so many things, including remdesivir in the early days, limited capability and limited scope. This is not intended for somebody who regrettably is already sick enough to be in the hospital, nor is it intended for somebody with very mild symptoms, blessedly, and they're doing well. This is sort of that middle zone of patients. And while it is optimistic and hopeful, again, we're looking at a limited resource, limited scope initially until we can ramp this up.
Okay. So, and I think that when people hear that good news, they cling to that promise, but it's not going to save you. It's not going to save everyone, is what I want to say. Correct.
A lot of, to put it in context, when we heard about remdesivir or the utilization, the discovery that steroids help in certain patients, or that we now have this antibody therapy coming from Eli Lilly, it engenders this optimism and hope because, frankly, we're desperate for hope. We're desperate for good news, and that's human nature. We should be that way. We should stay hopeful and optimistic. But we need to understand that these are not panaceas. These are not silver bullets. They don't just immediately wipe out the infection in an affected individual. What they tend to do is decrease the severity and or length of the illness. Some individuals, regrettably, will still progress. So it's important to remember that we still need the best treatment for COVID-19 still to this day is not get it in the first place and or halt the transmission if one has it. And that's where all those safety mitigation measures, quarantining, isolating come into play.
For those of you who are just joining us this morning, I'm speaking with Dr. Mark Casanova, the president of the Dallas County Medical Society, who's also on the COVID task force here. And I have so many good questions from people, so I do want to get to them. And if those of you on Facebook right now, I see your questions coming in, and I'll try to get to them. We've got one question from one of my Instagram followers who asks, what can I do in our home to prevent the spread if we are waiting on test results for my husband? I thought this was such a good question because I think a lot of people find themselves in these situations. They're waiting for test results. It's her husband, their two daughters. So what can they do in the meantime?
So, reading or listening to the question, it sounds like the husband is the individual who's potentially infected, and what they would want to do is, to the best of their ability within their home, is keep him in a separate bedroom, separate bathroom. He should mask, and they actually should all be masking within the home. Frequent hand washing, sort of, get them a meal to the bedroom door. They should not congregate around mealtime, especially when, understandably, we're not wearing a mask when we're eating. So,
and this is before a positive result.
Yes, before a positive result. If it's on your radar and you're concerned that this is a possibility, those are the things you want to do. It's really no different than if a friend calls you and says, hey, bad news. I know we were together on Sunday. I tested positive. You immediately, in your mind, want to say, okay, I need to start to separate myself from others. I need to figure out, do I need to get testing? What's the time frame for that? But yes, you want to approach it as, okay, I've been potentially exposed. And in a situation where your loved one is under the same roof, you need to kind of operate under that same modality until your friend gets her husband's test results back.
And now I know some other people who say, I went and got this test, it came back negative, but I have all the symptoms. So right. Should they go get another test, or should they just sit tight?
Well, great question, because there are a lot of things that can mimic COVID-19, of course, seasonal influenza, other colds, illnesses, sometimes super bad allergy flares. I think what the individual needs to do is really ask themselves, what was my exposure risk? If I had a really high exposure risk, and I know I did, I think you'd likely want to fall into the camp of saying, listen, the test may have been negative, but it's walking, talking, and quacking like COVID. So I'm going to behave like it's COVID. I'm staying put for my full 10 to 14 days, let these symptoms abate before I go back out into the world. If there's reasons why the individual would say, I really need a repeat test, then that's certainly something to consider. It's also important to consider, what test did the individual have? If they had the antigen test, there's a decent percentage probability that was a false negative. And many antigen tests are backed up by a PCR test, which is really the gold standard. So a lot of aspects to those scenarios, but if it's walking and talking and quacking like COVID, go ahead and behave like it's COVID. Inform your circle of friends and family who you may have been in contact with, especially if you know you had a known exposure.
So notify people who you've been in contact with in what framework of time? Like if you're like, I don't know, I started getting sick or I started feeling weird on Friday, how many days back do you go before Friday in terms of notifying people?
Right, about 3 to 5 days prior.
Okay.
About 3 to 5 days prior. And then again, if you know that, well, I was at a gathering and there was 15 of us and it was on Sunday, then you can rest assured, and especially if others are testing positive, that was your exposure.
Sorry, I do want to talk about testing too, because I think that people still right now are like, what is an antigen test? What is a PCR test? Is a rapid test as good as a nasopharyngeal swab? Because I want to know right now, what do you tell patients when they go, I'm having symptoms, what should I do and where should I get tested? I know there's still a lot of free testing out there as well.
Yes, there is. And if you're wondering where the free testing is, simply go to the magical unicorn called Google and type in, where do I get free COVID testing in Dallas? And immediately we'll take you to the sites. I did it this morning. Parkland is still running free testing sites, as is the Dallas Department of Health and Human Services. So, testing is really right now three testing modalities. There's the PCR, the antigen testing, also referred to as the rapid testing, and then there's antibody testing. Really for diagnostic purposes, if you need to know, have I acquired COVID, it's really the PCR test or the rapid antigen test. Both tests involve swabbing your nose, okay? The PCR is a deeper swab, so the nasopharyngeal swab than the rapid antigen test, but both are nasal swabs. The antigen test is designed to detect the outer coat of the virus, what we call the antigen. Okay, that's the surface of a surface molecule on the virus that's actually involved in the virus attaching to our cells and then gaining entry into our cells to reproduce itself. So in theory, it's a direct test to say, do I detect the antigen, the outer coat of this virus in this nasal swab? It is swab dependent. So if it's not a deep enough swab, you may get a false negative, meaning you really have it, but you sort of missed it in the snapshot that you took. There's also the possibility of false positives. In other words, some concerns early on were that, well, what if you have just a run-of-the-mill, regular, good old-fashioned coronavirus infection and not COVID-19? So we need to acknowledge that no test is perfect. I think the rapid test is useful if there is a relatively low index of suspicion or it's being used to screen a large group of individuals. Maybe we're using it on college campuses where you do need that rapid information. Maybe some airports are using it to just say, hey, it only takes us 15 minutes. We might miss a handful, but we're checking the masses to ensure that we're not positive. If you believe you've been exposed to COVID and there's a pretty good probability, you really want to go with the PCR. That's the gold standard. That's the nasopharyngeal swab, a little bit deeper. I've had it done several times myself. Not exactly comfortable, but not the worst thing in the world.
What is up with, I know people who say that they've been swabbed on the inside of their mouth.
So some of our testing platforms are now moving to saliva-based testing. Mm-hmm. So I think that's another modality on the horizon. It still can use either PCR evaluation or antigen evaluation, but yes, saliva-based testing or even, kind of spitting in a cup based testing is coming down the pike. Yeah.
Are those tests as sensitive as the nasopharyngeal swabs?
They can be, depending on the testing platform, and there's still a lot of work and evaluation going into that. I think ultimately they can be as sensitive. They also have their own utility in being used to test larger or at least medium-sized groups to determine, does a basketball team or a football team, for example, do any of them have COVID-19? You could do batch testing with saliva testing. So I think the gold standard as of today, however, is still the PCR nasal swab, which basically takes a swab and then amplifies any virus that may be present. So it's different than just saying, is the outer coat, the marker of the virus present? This is saying, is the real deal virus in your system, or at least detectable in your nasal cavities?
Yeah, and I know even these self-tests, I'm like, man, I don't trust myself to do it the right way. I want someone to do it for me so that I am sure of what's happening here.
Right. I would agree. And that goes back to the quality of the swab. If you don't get a good quality swab, you're not going to be able to really rely heavily on that test result. So I think it's mild discomfort at worst. You get some watery eyes and an itchy nose. It's temporary. It's short-lived. And the alternatives are much worse.
Yeah, I'm imagining it right now. So I've got another question from a woman who said, there have been cases of reinfection. What are the odds? Now, you were involved in the discussion that I had, 2 weeks now ago with Bo, who had it back in March and then got it for a second time in October. So what do we know now about how many people are being reinfected? Because, yes, antibodies is something to celebrate, but we don't know how long those are present in the body. And it seems like every body is different. Each person is different.
You're absolutely right. So here are the things we do know, and there's still a lot that we don't know. We do know that the so-called regular coronavirus, that family of viruses, does not tend to offer sustained immunity. So, you can get sort of the seasonal crud every year or every several years. And there's a good chance that that's a coronavirus strain. So it's not a virus that tends to offer sustained immunity. It'll give you antibodies in the short term, but eventually at variable speeds and at variable degrees, those antibodies will wane depending on the individual. The other thing we know is that, worldwide, or at least let's just take it in the United States, we've had this around since January, ballpark. In North Texas that we know of, identified first in March. What that means, what we need to understand is there's still time. there's still a lot of time that is needed for individuals who have been infected early in the course to unfortunately have antibodies and protection wane and then potentially be infected again. So I think we're just in the early stages of beginning on a worldwide basis to see reports and a steadily increasing number of individuals who are becoming reinfected. Is it a guarantee? No. What are the odds? We frankly don't know. Is it a possibility, however? The answer is yes. And we know that from the behavior pattern of regular coronavirus strains. And we know that from what we're seeing with modified clear reinfections. So once again, all the more reasons to not let your guard down, nor fall into the trap of saying, well, I've had it before, and so therefore I'm protected. I at least can get back to living life normally. That's not a well-informed approach.
Or, I can hang out with this person because they've had it, so I'm safe. Now, and I know a lot of people have asked, can you still pass it to someone if you have had it? Can you, but don't currently have it? Can you still pass it to someone? Well, let's just ask this. At what point can you pass this virus to someone?
Okay, great question. So if we envision in our mind sort of a bell-shaped curve, okay, and there's actually two bell-shaped curves. The first bell-shaped curve is when you have the virus in your system, and it's actually the viral level and then your ability to shed the virus, it's on its way up, typically before you even become symptomatic. Mm-hmm. So by the day you become symptomatic, you've had it on board for 3 to 5 days prior, and that viral load is ramping up, which means you're transmitting or have the potential to transmit even before your first symptom. That morning you wake up and think to yourself, wait a minute, I don't smell my coffee this morning. Mm-hmm. Well, you were, and if you think to yourself, crud, I was with a group of friends last night, pretty good chance you were shedding virus. You then become symptomatic, and through that symptomatic phase, the viral load and the viral shedding begin to trend down. That's why in some instances, timing of the testing is important as well. If you test 5-6 days after you developed symptoms, your viral load may be at a level that might be undetectable by the test. And then you kind of walk away thinking, well, maybe I wasn't infected when in fact you were. So I think it's a great question. If you listen to many of the stories, the familial gatherings where there was transmission, the friend gatherings, the gatherings at a happy hour or whatnot, the classic story is, everybody gathered together. The next morning, somebody calls, or 2 mornings later, somebody calls and says, sorry, folks, I was infected. And almost within 24 hours, you hear, several of those other attendees report in that they're symptomatic as well. So that's the evil nature of this virus is it's shedding and transmitting to a greater degree, typically 24 to 72 hours before you're even symptomatic. And then the viral load and transmissibility begins to fall. Now, for mild cases, you don't land in the hospital is what we consider to be a mild-ish, moderate case. You can probably re-engage in the world after 10 to 14 days. CDC has adjusted that time frame. I think if you're really concerned, there's no harm in going the 14-day route. If you've had severe case is you probably landed in the hospital or very severe symptoms that you were able to sneak by at home. That time window is about 21 days. Now, it's important to remember if you test that individual at day 25, they may still test positive because we're catching viral RNA, but that doesn't mean that viral RNA is actually transmissible. It's not sort of active transmitting virus. Long-winded answer, good question. If folks are in a peculiar situation, not sure what to do, call their physician.
Yeah, and I'm sure that, it's part of this, you guys who are watching, and maybe we have our friends on the Daybreak Facebook page now, who are joining us through I Am Still Up. Good morning to y'all. I'm talking with Dr. Mark Casanova from the Dallas County Medical Society about COVID-19 cases on the rise in North Texas and really across America, across Europe as well. This is why we in large part say to minimize your risk. It means, minimize your movement, because if you're going back in your head, 5, 6, 8, 10, where was I on Tuesday at 5 p.m. and then 6 p.m. and if you got so much going on, it's kind of hard to trace back. You talked about gatherings, and I do have one question from someone who says, well, the holidays are coming up. A lot of us want to spend time with elderly family. So, I can't prevent people from doing what they want to do, but let's say they are going to go that route despite guidance or recommendations. What is the best practice? What's the safest practice for people who are wanting to do that?
So a couple of thoughts in that arena. First of all, ask yourself a couple simple questions. Why do you want to visit that individual? I'm going to hazard a guess it's because you love them, right? And you care about them and you miss them. Next question is what's the potential risk of COVID for them? What's the potential risk of COVID for you? If you love them and they're at risk, as well as if you're at risk, the simple answer and the only answer we can give is the safest way to do that is to not do it, unfortunately, to connect via this mechanism, to call them and tell them that you love them and care about them, you're thinking about them every day. If still, as you say, individuals are going to make those decisions and gather, then there's several steps that have the potential to minimize risk. I emphasize potential. First of all, the clock is ticking. If you haven't already, in essence, locked yourself down, you need to, meaning you need to really batten down the hatches, go to work, go home. If you have the opportunity to work from home, minimize your exposures to anybody outside of your own home. And give yourself, in an ideal world, a 14-day sort of self-quarantine, if you will, to minimize your risk of acquiring the virus. When you're there, no contact, no hugs, as hard as that may be. Grandma needs or Papa needs to wear a face mask. You need to have a face mask at all times. And if this is, in fact, more for a Thanksgiving visit, for example, come mealtime, you sit in different areas of the home. You play the quiet game, you eat your meal in silence while you're obviously unmasked. And then as you gather back together in a congregate setting, masks back on. Outside if possible, if feasible, depending on Texas weather, and that's always a roll of the dice. Windows open in the home or the setting with the central air unit turned on, not necessarily hot or cold, just the fan blowing to increase air circulation. There are ways to minimize it, but if the question is what is the safest approach, the academic answer is to not do it.
Yeah. And
not do it based on love, the same love that compels us to want to gather with our parents, our grandparents, and those that we care about.
Yeah, no doubt. Another question coming in, and this is a good one. What can people do to overcome pandemic fatigue? And to this person, I would say, one of my fitness instructors said it the best in a Zoom interview. He said, what this year and what this experience has taught us is how to be still with ourselves, like how to deal with ourselves, right? So when you're fatigued, the answer is not to go out and distract yourself, but to actually sit with yourself and say, why am I feeling this way, right? So I still haven't, for instance, gone back to gyms to work out. I'm still working out at home. There's a ton of online resources. If someone out there is listening and saying, I just need to move, I need to work out, I need to get some energy out. I do go on walks outside. It's been beautiful. We're not going to have that for long. There are ways to kind of entertain yourself outside, but also inside, maybe some reorganization, maybe reconnecting with an old hobby like music or art. I think you become more fatigued with things like Netflix, even though I dip in and out of these shows a little bit. Mm-hmm. But I think, the more you're just laying there, the more fatigued you get. But I don't know, Dr. Casanova, do you have something else you'd like to say in this realm?
No, I mean, I think those are all excellent points. I would definitely avoid any zombie apocalypse shows on Netflix.
Yeah.
Let's not let our mind go there right now.
Yeah. Do something productive with your mind. There's another woman I've been chatting with who she suggests doing something new every day. And
Yeah.
and yes, it's still possible even in this time, sitting in a different place to drink your coffee, maybe drinking tea instead of coffee, experimenting in the kitchen. There's a lot of ways to expand while you're still limited. So,
Right. And I think, the question is an excellent question. And I'm sitting here, I let the question sort of fall on me and resonate. And here we are, we're getting optimistic and excited about, this vaccine and other things. What we wouldn't give for a magic bullet to treat pandemic fatigue. There is no pill for it. There won't be a pill for it. I sometimes use a phrase, you need to really sort of dig deep. And I think that resonates with what you're saying is you really need to, it's not falling into yourself in terms of isolation, but it is really digging into that inner strength and reminding ourselves as individuals and our connection to others, because I think that's what we're missing. We're missing that connection to others. What is that connection? That connection is simply love.
Yeah.
And when you pull all the labels away, it's love. It's agape. It's that human connection, and that's what we're missing. But the irony is just the way that we maintain that long term and get through this, and especially maintain that direct love of family and friends, is to have these safety measures, to have that separation for a spell of our life. And it's a big ask. It's been a hell of a year. And we're still at it, and we're going to be into it in 2021. But we will get through this, and we want to do it in a way so that in 2022 and beyond, we still have those individuals we care about to directly continue to love and directly continue to share life with, and not have to reminisce about that individual we lost prematurely and preventably to COVID-19.
What's interesting too is I just shared an article. I think it was from Reuters, but sort of it's gone all over the place now, about mental health and people who have contracted COVID, and how much higher how much higher the risk is for someone who has contracted COVID to experience some of these mental health issues. And I did have some people say, well, Sonia, are you sure that it's not, because of that isolation, because of that social sort of disconnect, or is it actually the disease, the virus? I don't know how you feel about talking through that. I have got to pull this shade down because now the light's in my eye.
Okay.
Although maybe I'll just move around. Maybe I can do that. Okay. So whatever, doesn't matter. What you're saying matters more than what I'm looking at here.
Yeah. So let's touch on mental health in a time of COVID, because we're all struggling, period.
Yeah.
Hard stop. We're all struggling. In times past, I might have gotten through a week of seeing office patients and maybe was able to count on one hand the number of patients who spontaneously said, Dr. Casanova, I'm feeling depressed, I'm feeling anxious. Now it's the opposite. I go weeks and I can't think of a patient who hasn't spontaneously mentioned that.
Wow.
So that's the baseline that we're living in right now, and it's real and it's understandable. And again, these expressions of I'm feeling anxious, I mean, a lot of it is the world we live in. There are other factors involved in that. Some of that I think maybe is quieting down to an extent, but it's taken a toll and it's worn on us. For those individuals who have had COVID, and I've cared for some and have been in contact even with some friends in the midst of COVID infection, there are those, it's very mild. They'll share concerns of, maybe like, gosh, I can't believe I got this. I'm a little bit nervous. I'm a little bit scared. I've had others with more moderate illness, and these are young, healthy individuals. And we were in regular contact through their journey, and there is frankly dread in their voice. I mean, they understand when they get it and they're short of breath and they're having difficulty completing full sentences, and they're an otherwise healthy 47-year-old. They know enough to know what this could unfold. how this could unfold. And I think that that's that residual depression and anxiety at an increasing rate that we're seeing with individuals who are recovering from COVID. I don't think it's above and beyond the baseline separation, because we're all struggling with that. So I really think it's that dread of, oh my gosh, am I going to be that one that that does worse than the statistics suggest I should? And that's that unpredictability component to it. And here's the crux of the matter. The dilemma we're in is that if we say it's the separation that's precipitating this depression, anxiety that abounds, well, if we were to say, well, then let's treat that with just gathering together, we've just crushed ourselves. And it's almost like it's, in a way, it's feeding itself. But I think if we can shift the context and remind ourselves, yes, I'm lonely, yes, I'm depressed or anxious, but this is for a period of time. It will get better. There's hope on the horizon. And when we come out the other end, I'd much rather be alive and have my friend and family units alive than no longer be depressed or anxious because I'm dead, or no longer have my father be depressed or anxious because he's dead.
Yeah. This is a good question too. Where are people catching the virus? What kind of activity links the new cases of any, and this goes back to, where did I get this? I don't know. Did I eat without washing my hands? Did I rub my eyes after touching 7 doorknobs and the car door and then the elevator button? Or is it sort of more, I don't know. Am I being too nuanced, I guess?
No, I think actually that's a great question, and it's a good topic to touch on, because there's some themes there, and there's some data that we're seeing epidemiologically, both in our region and across the nation. It's not the doorknobs, it's not rubbing your eyes, it's not washing your hands before you eat, but you should. So please do that. It's really 2 components. It's large gatherings; those sometimes we refer to those as those super spreader events. And it's actually, to a greater degree, smaller, medium-sized gatherings. That's the foot on the gas pedal right now. That's driving this. It's and frankly, there's not a whole lot of large mass gatherings. We do obviously have concerns when you see these large, maybe outdoor events or quasi indoor outdoor events, for example, like a football game. Fine, you can separate, but what about those ingress and egress points? What about all that, coming in and leaving? You're in close proximity. So those things give us concern. But it's also a large number of 5 to 10 person gatherings, birthday parties, a little gathering, feeling like, hey, the governor said the bars could open, so it must be okay. Let's go to our favorite restaurant again. We haven't been there in months.
So all of this is indoors, you're saying?
Yes. A lot of it is indoors. So it's those indoor gatherings.
Yeah.
And if a family says, the other struggle is okay, well, we're listening to the news and we hear Sonia suggest that we could do this safely outdoors. Let's go have an outdoor backyard barbecue, but with about 20 people. Okay, fine. Right. But you still got to stay masked. You now have 20 people there, and it's Texas. And so good chance 3:00, the rain clouds come in, and what do? You all move indoors. You just negated all the potential protection you have by doing it outdoors. So the foot on the gas pedal right now, and why we're seeing this exponential increase, is just a great deal of transmission amongst small to medium-sized gatherings in indoor settings.
Dr. Casanova, I had a conversation last week about how common it is basically to get it even in your own house. And I think that makes sense too, because if you do have 1 or 2 family members who are working and they have to, right? Or kids are going to school. And I know that there are on Facebook this morning a lot of concerns around schools and what that means. But if you still have activity from the inside of your home to the outside, what's the likelihood that then you could catch it inside your own home?
Oh, it's a great likelihood. And again, we're seeing a lot of that familial transmission and familial spread. We talk about and we emphasize that to move the needle in terms of, for example, mask compliance, while we desperately want everybody to wearing a mask when you're outside of your own home all the time, the reality is to move the needle, we need a few percentage points. We need a few percentage points of tightening it up, batten down the hatches. But all that gets negated and thrown out of the water if we engage in activities where we're indoors together, where we're not wearing our mask, right? Mm-hmm. That's eating, that's gathering socially, that's doing things where a mask just isn't worn or doesn't work. So we could all keep that mask on as we're going to the grocery store and Home Depot and going to and fro from work. But if we go in that break room and we pull it off around 5-6 other people, we have that baptism party at our home and we're not wearing the mask as we're enjoying our lunch, we just wiped it out.
Okay, yes or no? Can you be tested for COVID and the flu with the same nasal swab?
No.
Okay. And yes, get your flu shots if you haven't had them already. Okay, wow, we have so many great questions here. Are people with second infections, so reinfections, having different responses or symptoms? I would say yes, just based on the conversations I've had, but I don't know what you're seeing, like larger scale.
Well, we're only in the initial phase of seeing individuals with reinfections. Intuitively, theoretically, it could do just damn near anything. So I would say that there's not a reason why they couldn't have a whole different spectrum of infections or symptoms than they did the first time.
Okay. Let's see. I want to make sure. Well, someone says concerns about schools. Now, I don't know. And I don't have kids, so it's very hard for me to make a judgment call on what someone, I do have a niece and she is going to school because both of her parents have to work. And the only other place she could be is my parents' house. And my parents don't know enough about technology to help a second grader with her, Zoom schooling or whatever they do. But, do you have any thoughts around what we've seen, whether it's sports and extracurriculars or the streamlined new age school day? I feel like when I've talked to my niece, they're wearing masks the whole day. Even at recess, they're, outside and wearing masks. They also have to sit a certain number of seats apart from people in the lunchroom. It's not a perfect system, but it's sort of okay for now. I don't know. How do you see it?
I would agree. And it should come as no surprise that our education system and our teachers and principals and school districts are very concerned about the health and welfare of our children and of course, our teachers and so many people that we value in the education system. I think they're doing a good job. I think they're doing the best job they possibly can given the circumstances. We are not seeing a huge contributing factor to our current numbers arise from schools. We do know that masking is key. So even, when you're indoors for, even if it's an abbreviated school day, maintaining that mask, maintaining that physical distancing works. It has a potential to mitigate the spread. It's also important to understand that, we do need to differentiate if we're talking school age children versus colleges. Those a whole different story. But even within the spectrum of school age individuals, kindergarten to 12th grade, there's a cutoff point. So the data suggests that pretty much 10 and below, yes, they can acquire the virus, very rarely significant effects, but it can happen. But they don't tend to transmit the virus subsequently to adults to the same extent that really 11-year-olds and above can. Once you're above 11, you basically have the same potential to transmit and bring it back home and give it to grandpa or whatnot. So you see a lot of school districts take that into consideration, how it affects extracurricular activities. Do we maybe keep the upper level children at virtual or half days, or really try to minimize their congregate exposure to each other? So it's not a one size fits all, but we will say that yes, we've seen an increase in the number of children have test positive as they went back to school. That was sort of on our radar and anticipated and expected, but that doesn't seem to be a major driving factor. Shift to colleges and universities and young adults in that 20-ish-year-old age group, we definitely know that in the previous month, they've been a significant driver, unfortunately, and contributor to the increase in cases, which are now splaying back out to the variety of age groups. So a month ago, we were seeing really young adults as being the primary driver of positive test results. Now what we're seeing is it's reaching right back up to our elderly individuals, at-risk individuals, hence increased hospitalizations.
Yeah. Lisa makes a good point here, and I'm wondering if you can kind of add. She says, I've heard that you have about 10 or 15 minutes of being around someone who's positive before you could catch this. Is this true?
Right. So I think early on, or through the course of this, the CDC had a reference to, I believe they refer to it as a significant exposure. Was it considered to be a significant exposure? Mm-hmm. I think that was measured as, being in relatively close contact for 15 minutes or more. I think we've really realized, and especially as we've kind of understood that, we understood early on, well, this is droplet transmission. But as we began to appreciate, no, there's probably more than droplet transmission here. There's some airborne transmission. The short answer to her question is yes, 10 to 15 minutes is adequate time to acquire COVID-19 from another individual. Could you acquire it less, especially if you're a little bit closer? Hands down, absolutely, especially if you're both unmasked. So hopefully that answers her question, but yes, it could be 10 to 15 minutes or even much shorter.
So I'm getting some school comments now. These kids cannot sit 6 feet apart in schools. Someone needs to be honest and talk about this openly. COVID-19 is running rampant in our schools. And so I think going back to what you just said about the differentiator in elementary schools versus middle and high schools or in colleges is one thing that schools are taking into consideration. And if a virus is spreading around in a school, doesn't that the community is at play there as well, because the school is part of the community. Absolutely. And then of course the teachers and the staff. And the precautions, that they're taking because they're going in and out of the school as well. Right. And their families. We're all connected. Right. Do the kids need to sit 6 feet apart all day long, for instance?
Let's answer it this way. The farther apart, the better. And really the strict mask wearing that entire duration is key as well. If third graders were 5 feet apart but always wearing masks and so forth, there's at the end of the day there's going to be realities that intersect recommendations. But I think that the mask wearing, the maintaining as optimal distancing as possible, and the frequent hand washing, hand sanitizing, it's feasible. Now, if you have a significant outbreak within a school, then the school and the district needs to reassess, and they will. So it's not a universal answer that says, okay, well, this is always fine and good for a particular situation. Schools will need to reassess. If it's middle school or high school, yes, significant outbreaks. There may need to be those stops that we've seen for various schools where it's back to virtual now, or a certain class needs to go home and do it virtually for 2 weeks. But if your kids go home and play with other kids in different schools and different classes, and that's the thing. It's so right. Hard. I don't envy parents right now. I really sympathize, and I think that being a parent right now would be incredibly difficult because I can't imagine having a middle or high schooler and trying to tell them not to do
this or this or this or this or that. They just want, when they just want to do stuff. The little kids hopefully will listen to you a little more. Okay, so I've got one more from Chris who's saying, what is our current positivity rate and percentage of hospital beds? What percentage of hospital beds are occupied? And I know the mayor of Dallas at least used to tweet out, I think every day, all those numbers, but kind of like you said earlier, the hospitals, what are you paying attention to? The rate of hospitalizations? Because I think, and I think this question comes from watching images out of, let's say, El Paso, right? Where you're going, oh my gosh, what is going on? Or a lot of rural towns in Texas, they're at capacity. They don't have the staff. They don't have the hospital beds. They don't have the space. And then you have a community, some of these places that we're talking about, it's an older population. A lot of people, when you talk about the Rio Grande Valley, when you talk about El Paso and West Texas, they don't have health care. Diabetes is more common in some of those areas. And so you have to take all of these factors, I think, into consideration. But how are we faring here, would you say?
So I don't want to misspeak about the exact numbers of percent positivity in hospital, percent of hospital occupancy attributed to COVID, though I just heard these numbers last night. I slept in the interval. I can say that, right, yeah, I could say that both are going, certainly the percent positivity is clicking up.
Yeah.
And hospitalizations are heading up dramatically. Now, one thing about, so there's a difference in, and I want to caution folks in looking just at the percentage of hospitalizations right now that are attributed to COVID-19 patients. And it's a little bit different situation than we were in the spring and in the summer. If you recall, in the spring and the summer, we had shut down elective surgeries and whatnot. So the mere percentage in the numbers game was a higher percentage at that time. We have, and we continue to still have elective surgeries, which is really a misnomer. It's really non-emergent surgeries, but still very important and urgent situations that are going on. But what's also important to remember is at this time of year, we normally see increased hospitalizations. Mm-hmm. So that's baseline. So you have a total number of hospitalizations going up. You have COVID-19 hospitalizations going up. So you don't see that sharp increase in percentage, but the sheer numbers are going up. Hopefully that answers the question. Hospital capacity right now in North Texas, well, let's confine it to Dallas County.
Right.
We are okay. Okay. We are not great. We're not bad. It can change dramatically in short interval. A lot of ICU capacity in Dallas County right now is running in that high 80 to low 90% capacity. Now, we can always surge. We can always reformat or recondition rooms to become ICU rooms. That's what we did in the summer in many institutions.
And I'm seeing that become a trend again. That's another thing that my friends in hospitals have said, we're reinstating COVID units, basically.
Exactly. So you all those factors kind of get worked in. So you really kind of need to look at it from a big picture. If we just look at one number, what's the percent of COVID positive patients in a hospital? It gives a glimpse, but it doesn't really paint the full picture. Suffice it to say, both are on their way up: percent positivity, hospitalizations, ER visits, doctor visits for COVID-19 like illness, all heading up.
Yeah. Okay. Dr. Casanova has been with us for an hour now. I know you've got patients. I know you got things to do. I just want to end on this note because one of my friends, I just had posted on Instagram yesterday. I have 5 friends who tested positive in the last couple of days. And this person says, you have 2 more. We tested positive last week. I'm pretty upset about it, but our neighbors didn't tell us that one of them came across 2 workers who were positive until we had already been at their house indoors for an hour. They didn't tell us they had symptoms. They didn't tell us they had gotten tested. They just told us once they knew they were positive. To clarify, we spent time with another couple on Halloween. So 2 of us and 2 of them. You'd think the rules of engagement and decency and transparency are clear now, but apparently not. Another neighbor who popped by outside got it. and a fourth house just tested positive, this thing moves fast. And I'm sharing, without telling people who these friends are, but the fact that this is happening now to, like we said, the circle feels like it's getting smaller. And people aren't telling people that they have it. People aren't telling people that they don't feel well. People are still going out and doing things even after they've been tested and they're awaiting test results. And these are things that we've been highlighting. Basically, that part of the story hasn't changed. There's evolution in science, but this part of it hasn't changed. So I appreciate you for making time, more time for us to talk through some of these things. And I don't know if you have any final thoughts before we let you go for the day.
Yeah,
I know. I get texts like this every day.
Yeah, sometimes you run out of words. I know my wife would love me to run out of words more often, but sometimes you just run out of words. I mean, listen, folks, it's if you even think there was a risk, batten down the hatches, pick up the phone, do a video call. Yeah. Just don't put others at risk. We're informed respect. Doesn't have to be fear, just informed respect. That's all we're asking. Wear your mask, be safe, be mindful, stay strong, dig deep. We've got your back, but we in healthcare, we could use a little help. And so please, we're not ashamed of asking for help. Please help us.
Yeah. And we are here for you. If you have questions, you guys can always reach out to me, and then I can filter through Dr. Casanova. We've got a couple of other doctors we work with who are incredibly helpful and insightful and informed. And so please feel free to message me anytime if you've got a question. There's no silly question here. So thank you for your thoughtful questions, by the way. Friends on Instagram, people on Facebook, on Twitter, everyone sort of weighing in. And this is giving us a little bit of a feel for where we are now. So hopefully we can come back together in some weeks or months and say we're in a better place and in better shape just because we've all taken care of each other. So Dr. Casanova, thank you so much for starting the day with us. Appreciate it. Talk to you soon.
Absolutely. Be safe.
All right, you guys have a great day.